today's video, we will discuss about some of the substances which will lead to withdrawal symptoms. This particular topic is being asked in Jan 2025, paper 1 of MD General Medicine examination of RGHS. So we will discuss in brief regarding this topic. First point is the withdrawal management. We have to understand whenever a person is actively dependent on a particular substance, and when we plan for complete abstinence and psychological treatment of that individual, in between what happens is when we advise for the stoppage of that particular substance, they might experience withdrawal features. So those things we need to take care of. So what is withdrawal management? It is a medical as well as psychological care to reduce the discomfort and safely stabilize the patient who is actively dependent on the substance and build the clinical trust. But what withdrawal management does not mean is a cure for dependence. It does not mean if we manage the withdrawal symptoms, the individual will be cured from the substance dependence, and it does not lead to sustained abstinence alone. So it has to be followed by psychosocial support and treatment for the maintenance of abstinence. So some of the substances which they have asked to enlist first. So commonly alcohol, opioids, benzodiazepines, some stimulants, inhalants, even cannabis. So these are some of the substances. People will be actually getting dependent on these, and also there will be possibility of withdrawal symptoms. So we will discuss all of these one by one. When it comes to alcohol withdrawal symptoms, the onset will start after 6 to 24 hours of abstinence, and it will peak by day 3 to day 6, and there will be resolution by about 8 to 10 days in general. So during this abstinence phase, what symptoms will be there? The withdrawal symptoms usually will see tremors, excessive perspiration, insomnia. Sometimes it might be even severe enough to cause seizures, delirium, hallucinations. So these are some manifestations of alcohol withdrawal symptoms. So we have to calculate the alcohol withdrawal symptoms scores. So based on that, we can divide it into mild, moderate and severe withdrawal. And for all of these, how to manage is mainly hydration, about 2 to 4 liters of fluids every day. And thiamine is very important to prevent wernicke's encephalopathy or cognitive impairment. And also in case of excessive agitation or tremors, irritability and all, we can utilize benzodiazepines like diazepam or midazolam, lorazepam and all. But we need to monitor for excessive sedation, and sometimes it might lead to respiratory depression as well. So only if the symptoms are severe or moderate, we have to take help of diazepam. So once the individual reaches back into mild withdrawal phase, we can stop taking help of benzodiazepines and we can just manage with IV fluids, potassium, magnesium for severe dehydration. Then about opioids, there might be some short-acting opioid dependence like heroin. Sometimes there will be long-acting opioid dependence like methadone. So in short-acting forms, the withdrawal symptoms will start very early, within 8 to 24 hours of stoppage of substance, and the symptoms will persist for 4 to 10 days. Whereas in long-acting, the onset will be quite delayed, like the individual might develop symptoms after 1 or 2 days, and it might last for 10 to 20 days in some cases. So what are those symptoms during withdrawal? Mainly individual will be feeling sick, stomach cramps, muscle spasms, feeling cold. There might be palpitation, muscle tension, body pain and all, yawning, excessive watering from eyes, difficulty in sleeping. So all these might be the symptoms. So based on these, we will assess the individual as mild, moderate and severe symptomatic. So in case of mild withdrawal symptoms, just symptomatic therapy, hydration and vitamin supplementation will be helpful. Whereas in moderate and severe cases, we need the help of opioid again. For example, we can take help of buprenorphine or methadone or clonidine. So buprenorphine is the optimal choice and it will reduce the craving for the substance. Whereas methadone is best for long-acting opioid detox. And we can divide the dosage in the beginning few days to avoid the risk of overdose. Like we can give 15 mg in the morning and 15 mg in the evening. And clonidine will be helpful for symptomatic relief only. And as we know, there might be very high chances of hypotension, so we need to monitor blood pressure properly. Coming to benzodiazepine withdrawal assessment, mainly there is no such scale when it comes to assessment of symptom severity, but short-acting benzodiazepines will lead to withdrawal features within 1 to 2 days and it will last for about 1 month. Long-acting benzodiazepines, the onset of withdrawal symptoms will begin by 2 to 7 days and the duration might last for 2 to 8 weeks. So what might be the features? There might be anxiety or cognition related issues, even muscle pain, insomnia, all these things might be there. Along with the symptomatic management, in this case, we need to slowly taper off the benzodiazepine. For example, we can use diazepam about 40 mg per day during stabilization. Then we need to taper it off by slowly reducing the dosage and we can hold it for 4 to 7 days. Whenever we are reducing the dosage, we need to wait for 1 week between the reduction of dosages till we completely hold the medication. Here the point is, during all these process, if the symptoms worsen, do not increase the dose of diazepam for stabilization. Just stick on with the current dosage. Coming to some stimulants, mainly substances like methamphetamine, the withdrawal features will start very early, like within 24 hours, and it might last for 3 to 5 days, during which individual might experience agitation, depression. In this case, there might be increased sleeping or increased appetite. Sometimes the individual might even experience paranoid features and hallucinations, and we have heard about many instances where individuals might harm the others because of such paranoid behaviors. So we need to assess mental status continuously till the resolution of symptoms. So how to stabilize this case? Mainly calm environment, reassurance, hydration, and symptomatic medications for body pain and all. Then we can take help of diazepam like sedatives, maximum up to 120 mg. If you remember, in case of benzodiazepines, maximum we used to use only 40 mg. Here we can use up to 120 mg, but make sure that there is no respiratory depression because of the usage of benzodiazepines. So even with this therapy, if the symptoms persist, we need to transfer the patient immediately for a psychiatry unit. Coming to some other substances like cannabis, usually withdrawal symptoms will be mild, lasting for 1 to 2 weeks duration. The features might be night sweats, vivid dreams, GI upset and all. So management involves calm environment, the symptomatic management. Whereas in inhalants, the manifestations are poorly understood, but they might last for up to 2 weeks. Mainly we'll see headache, lethargy, hallucinations and all. So along with symptomatic management, we need to monitor the cognitive and mental status of the individual. Overall, we can take help of psychosocial therapy in some substances such as stimulants, cannabis and benzodiazepine dependencies. Whereas medical maintenance therapy will be helpful mainly for opioids, where the substitution treatment will be very, very helpful, mainly methadone. And in some substance abuse, like alcohol, we need to give support for cognition by supplementing with vitamin B1, that is thiamine, to prevent further deterioration of cognitive impairment. So as mentioned in the beginning, this withdrawal management does not cure dependence, but if we manage this phase properly, the individual will be successfully shifted to the next stage of therapy for complete abstinence of the substance. So this was in short regarding the enlisting of substances which will lead to withdrawal features and what will be the withdrawal manifestations and how to manage them in brief. Usually in paper 1, such vague questions will be asked, so it is quite difficult to compile the important things directly in the exams. So this video was just an attempt to compile few of those substances, and many times we have seen repetition of such questions. So please make notes of it and share it among your batchmates as well who are mainly exam going. See you in another such informative video. Till then, read well, and if you have any doubts, put it in the comment section.